The upper brainstem controls the mesencephalic reticular activating system. Again, another big fancy word. This controls your sleep and awake patterns. So it's firing at its highest at 3 a.m., then at its lowest at 3 p.m. That's why, folks, that fibromyalgia patients maybe sleep an hour or two, and then boom, they're wide awake. You know, you're not sleeping because the upper brainstem is overfiring. I can't say that enough. The upper brainstem is overfiring, and that's why you have the pain. Now, many fibromyalgia patients may have this fibro fog. You know, this fibro fog, this is when a patient or a person is cognitively, you know, just not with it. You know, they're confused, kind of dazed, or they're like in a fog. This part of the brain, right in through here, is called Broca's speech area. This is the area of the brain that allows us to communicate. It's allowing me to communicate to you right now. Then there's the Wernicke's area, which is the back part of the brain right in through here. This is the area that allows us to understand what's being communicated to us. It allows you to understand what I'm saying to you right now. And what connects the two is what's called the arcuate fasciculus. It's like a wire that connects the two. It's called the arcuate fasciculus, again, right in through here. Now, when this part of the brain isn't firing the way it should, the left brain, people have trouble expressing their thoughts. Things may be on the tip of their tongue. They can't seem to get out what they want to say. And they may have trouble understanding what's even being said to them. The left brain here, you see, this is your judgmental side, your analytical side. This side, your left side, is your happy brain. When the left brain isn't firing, a lot of times fibromyalgia patients will become depressed. Many fibromyalgia patients become depressed because they simply cannot find a doctor to fix them. Fibromyalgia patients may have irritable bowel syndrome, or they may have constipation. One day they have diarrhea, you know, the next day is constipation. Sometimes they may even feel this gassy or bloated feeling. You may have experienced this. Again, the upper brainstem stops you from going to the bathroom. The lower brainstem allows you to go to the bathroom. And in fibromyalgia patients, they may have problems with dizziness. It's because the cerebellum, which is this part of the brain right in through here, the cerebellum, that back part of the brain, it controls your balance and your coordination and your movements. You know what? It also controls all of your spinal postural muscles. Controls all your spinal postural muscles. And it's extremely common with fibromyalgia patients that the cerebellum here, it's not firing properly. It's not firing the way it should. This can cause neck pain or mid-back pain, even lower back pain. And some fibromyalgia patients may have this pain up and down their entire spine at the same time. If you can imagine that. They may have sciatica, which runs all the way down the leg. The shooting pain, the sciatica pain going all the way down the leg because the sciatic nerves is inflamed. Fibromyalgia patients may be even sensitive to light. You know, they're real sensitive to those bright lights. It's because out of that upper brainstem, right in through here, the upper brainstem comes the cranial nerve. The cranial nerve comes out of the upper brainstem, and it's this third cranial nerve that constricts the pupil. It makes the pupil smaller. When it constricts the pupil, you know, with fibromyalgia patients, this is simply not happening. Also, their heart may race really, really fast. This is called tachycardia. Or the heart may beat in what's called arrhythmia, where it's an irregular heartbeat. You may have experienced this. So, as you know, there can be a whole host of problems that fibromyalgia patients run into. The absolute bottom line is we know how to fix it. You see, our brain-based therapy has healed thousands of people across the country, other doctors that practice this type of therapy that suffer with fibromyalgia. So what do I do as a chiropractor that specializes in fibromyalgia? What do I address? What do I do that's different? Well, the very first thing is oxygen. You see, the cerebellum, again, this back part of your brain here, the cerebellum is the most oxygen-dependent area in your body. So we give our patients oxygen In our office, we use what's called oxygen concentrator. You know, it's giving the patient oxygen that begins to help them. And this oxygen concentrator is about 90% oxygen. And you know what? As we age, our ability to use oxygen, you know what? It decreases. And it's called oxidative phosphorylation. It decreases by 1% per year. So if you don't have oxygen, you're not going to get better. You know, your brain needs two things to survive. It needs fuel and it needs activation. Folks, fuel comes in the form of oxygen and glucose. Well, glucose is what you get from your diet, the foods that you eat. So it's important to have a good diet. Lots of fruits and vegetables, plenty of water, lean meats, whole grains. But the bottom line is you need oxygen. It has helped so many people in my practice. And we do also what's called unilateral adjusting. I'll be honest, folks. A chiropractor, most of the time, an osseous adjustment, which is a structural adjustment or alignment, may be way too much for a fibromyalgia patient to handle. That's the popping or the cracking. You know, most fibromyalgia patients actually, you know, they just can't handle this. As a matter of fact, they may even feel worse. After this type of adjustment, you know, we may even, and this may have happened to you, you know, getting these types of adjustments. We may use an activator. This is an activator. It's a simple low force adjustment that we use. It's a small handheld instrument that we use to make the adjustments. Or we may use what's called an arthrostim. Arthrostim here is another handheld instrument that we use. Really clicking using very light, gentle force. Like this. Really light force to make the adjustment. See, with some fibromyalgia patients, just the clothes on their body can be uncomfortable. Now, you've all heard that the right brain controls the left side of the body, right? And then the left brain controls the right side of the body. Well, what's happening? Well, what's happening is, let's say I found a decreased firing of the left side of the brain, right in through here. Well, the right cerebellum, which is this back part of the brain, right here, the right cerebellum fires, the right cerebellum fires to the brain. The right cerebellum fires to this left brain. So what I'd want to do is only adjust the right side in through here of the spine, upper body, to stimulate the right cerebellum, which will fire over to the left brain. See, this in turn fires down to the lower brain stem. When the lower brain stem is fired down to, the upper brain stem can then finally slow down, and your problem's resolved. You see, we also may do auditory stim, listening to different visual sounds in your ear, especially the right ear. We may do visual stim, a checkerboard pattern. We may do big letters made up of small little letters. Also, we may do a caloric, which is a warm water solution introduced into your ear. Okay? It hits the eardrum and comes back out. And what this does is it stimulates the semicircular canals. These are canals inside the inner ear and the vestibular apparatus in the inner ear. And inside these semicircular canals of your ear, you have what's called endolymph. Endolymph is like jello. See, when you heat jello, it liquefies, right? When you cool it, it becomes a solid. So heating this endolymph inside your inner ear causes it to liquefy and stimulate what's called these hair cells inside these semicircular canals, which are called stereocilia and kinocilia. These fire the vestibular nerve back to the cerebellum, which increases the firing of the cerebellum. The cerebellum fires the brain fires the lower brain stem, and that's what causes the upper brain stem to slow down. You see, it's a slowing down of this upper brain stem is what we want to do. So I know I repeat this many, many times, but I want you to understand that it's so important. And this is why fibromyalgia patients get better. This is why you will get better. We may do olfactory stim, smelling different smells. Very important to fire the brain. So your sight, your sound, your taste, and your touch all go through what's called the thalamus, okay? And then it goes up to the brain. Well, olfactory stim right up to the nostril, though, goes directly to your brain.